Okay, so welcome everyone. This will be our topic for today, validating data and documentation of data. Now, first we will start with validating data. Okay? The purpose of validation is to confirm and verify. Confirm and or verify that the subjective data and objective data you have collected is reliable and accurate. Okay? The purpose of validation is to check for accuracy. Check for accuracy of assessment. Okay? Check for accuracy and reliability of assessment. Now, in order for us to do that, class, we have to remember two things. Okay? We have to remember two things. What needs validation, and then how do we validate? How do we validate? Okay, so to answer the first question, we will go to the next slide, which is what data needs to be validated. Okay, conditions that require data to be rechecked and validated include number one, discrepancies between the subjective and objective data. When we say discrepancy between the subjective and objective data, class, there is a conflict. There is a conflict between our subjective and objective data. Let's say, for example, class, the patient tells you, I'm feeling rather hot and flushed. Okay, when we say they are feeling rather hot and flushed, they mean to say that they have possible fever. But during your, let's say for example, during your assessment, during your physical assessment, when you when you give them a thermometer, the result came out, the temperature was 36.5 degrees Celsius. Now that is normal. Okay? That is normal. Now, no, so there is possibly no fever. See, those two are conflicting. Okay? We have to check for discrepancies like that. Another is, for example, class, the patient tells you, another is, for example, a patient tells you that I'm feeling very happy. Okay, I'm feeling very happy. Good, happy kay siya. Okay? But, okay, they have just found out they have cancer. Now, if you found out, normally, no, if you find out that you have cancer, you would be very sad. Now, why is the patient happy? Why is the patient happy? Those are two conflicting types of data, di ba? Why would a patient be happy if they just found out that they have cancer? Okay, so what you do is you recheck, you revalidate. You ask them questions. Maybe you ask them a clarifying question, like, for example, sir, despite knowing that your diagnosis, despite just recently learning about diagnosis, may I care to know why you are so happy? Okay. Yes. Next is discrepancies or gaps between what the client says at one time and then at another time. Okay? What the client says to you at one time and then at another time. Let's say, for example, class, today the patient was admitted. Okay? The patient was admitted. And they tell you, I've never had surgery before. Surgery before. But tomorrow, or let's say for example, 4 hours later, they say, I've had an appendectomy 4 years ago. Now, those are two conflicting data points, no? Na conflict siya, no? Since the first statement says, no? The first statement says that they had never had any surgery before. But 4 hours later, no, the patient told us that they had an appendectomy 4 years ago, which is a surgery, no? No, so that is a type of conflicting data. In that instance, class, we need to revalidate or to confirm with the patient what the truth is, di ba? We need to confirm the patient what the truth is. Okay? Another is if the findings are very abnormal or inconsistent with other findings. Dili magkatugma ang symptoms, no? There is no consistency between symptoms. Like for example, class, during our physical examination, we found out that the patient's temperature is 40 degrees Celsius. 40 degrees Celsius. Now that is very hot. That is hyperthermia, di ba? That is now fever. Okay? But during our actual during our continuation of our physical assessment, we assessed, no, that they are just comfortable. They are comfortable. They are warm to the touch. Warm to the touch, class, is normal. Okay? Warm to the touch is normal. Okay? You are supposed to be warm to the touch, but not too hot. Okay? And then they are not flushed. Okay? Their skin is not flushed. Now those are two conflicting data points, no? This one is telling us that they have fever, while this one, class, is telling us that there is no fever. This one is telling us that there is no fever. Okay? When you have a 40-degree temperature, class, you're not gonna be comfortable. Okay? You are gonna be very flushed if you have 40 degrees. But in this instance, no, they are not flushed. Okay? Their skin is not flushed. So what we can do in instances like this is we need to validate, no? Probably we need to validate our thermometer. We need to make sure that it is properly functioning. Okay? Properly functioning. Okay, so we will proceed with our methods of validation. The first is always check your own data through repeat assessment. Like for example, class, ito previous example, our previous example, class, this one, our previous example. In this instance, class, we need to reassess. Okay? We need to reassess. Probably with a different thermometer. Probably with a different thermometer. We need to repeat our assessment, probably with a different thermometer. Now, a guideline, class, when using instrument is to always check your gear. Okay? Always check your gear. Check if they are functioning well. Check if they are working as expected. Okay? Another is to clarify data with the client by asking additional questions. Okay? For example, class, if you see the client holding their abdomen, example niya, holding their abdomen, you might assume, no? The nurse might assume, no, that there is abdominal pain. The nurse might assume that there is abdominal pain, no? But to be sure, no, because I have said before that we should never assume, we will ask the patient. Ask the patient to be sure, okay? Ask the patient. Okay? They might say, I'm just upset about my diagnosis. Okay? Now we have clarified, no? There is really no abdominal pain. They are just upset about their diagnosis, no? And maybe they are feeling nauseated. Yeah, mo na siya, no? Ask the patient. Never assume, as I've said, diba? Never assume, no? So, mo na siya. Next is verify data with another healthcare professional. Preferably someone who is more experienced. Okay? Preferably someone who is more experienced. For example, class, heart sounds. Now, for a rookie nurse, heart sounds are very difficult to assess, okay? Because most of them sound the same. Most of them sound the same, okay? But if the nurse is unsure, the nurse is unsure about that the sounds they are hearing, the nurse should ask a veteran colleague or veteran nurse. Okay, let's say for example you are assessing a patient and then you listen to their heart sounds, but when you are listening, class, you are not sure. Okay, you are not sure about the sounds you have listened. So what you do is you ask another nurse, ma'am, can you check these heart sounds for me? I just want to be sure. And then mo na siya, they will check it for you and they will confirm it with you. Okay? And lastly, class, is to compare your objective findings with your subjective findings to uncover discrepancies, no? Uncover discrepancies. Okay? Like for example, class, the patient might say, I'm not getting enough sun. I'm not getting enough sun. Dili kay siya mabuwad pirmi, di ba? But muna siyang yang subjective data, but our objective data finds out that the patient has wrinkled skin, suntanned skin, and a darker complexion. Okay? Suntanned skin and a darker complexion. Now, in that instance, class, we need to reassess the patient because maybe they have a different perception. On what they mean when they said not getting enough sun. Okay, maybe they have a different perception. Maybe they thought that getting enough sun is 8 hours a day, di ba? No. Okay, getting enough sun, di ba? Kadiyot ra na, it's very short for a day, no? So we have to check for discrepancies like that. Okay, and that is it for validation of data. Next is documentation. Now, papaday. Another is to identify areas, no? This is not documentation, this is still validation. Nasa iyo pa rin siya butang. Okay, validation. Okay. Another thing about validation is to identify areas where data is missing. For example, once you establish an initial database using our initial comprehensive assessment, you can identify areas where more data are needed. You may have overlooked certain questions in addition. Okay? In addition, as data is examined in a grouped format, you may realize that information is needed. The keyword there is grouped format. Now, class, for example, your patient weighs only 98 pounds. Okay, 98 pounds or around 40 kilos. Okay, around 40 kilos. You would explore further to see if the client recently lost weight, di ba? 40 kilos, 40 plus kilos, no? You explore if they have just recently lost weight or if that is their usual weight, ha? If you makakita ka class, if you determine or if you check that that is their weight, you can ask further questions. You can ask them whether that they have recently lost weight or if that has been their usual weight. Okay? It's something like that. Okay? That you are now grouping that data, no? That data goes under the group that is weight, di ba? The weight, no? Or their nutrition, no? That is what we mean when we say grouped format. Another is, for example, class, the patient tells you that they have had what we call bouts, or let's say, for example, chronic back pain. Now, during initial assessment class, all you will know is the characteristics of the back pain, no? But when you group this information together, when you find out their problems, you may find out that a chronic back pain, there needs to be more questioning involved, no? More questioning needs to be involved. Like, for example, class, you may ask questions like, when did this start? Okay? Or, for example, class, you may ask, did you get injured? Okay? And the answers to these questions, they should be grouped under chronic back pain, so that when another healthcare professional checks your assessment data, they will know that these questions are related to this one. Okay? Now, let us proceed to documentation of data. Documentation of data. The purpose of documentation, class. The primary reason for documenting the initial assessment is to provide the healthcare team with a database, no? Database, or what we call our baseline data, that becomes the foundation for the care of the client. Becomes the foundation for the care of the client. This documentation helps us diagnose or identify health problems, formulate nursing diagnosis, and plan immediate and ongoing interventions. Now, maglibog mo, class. What is the real purpose? The real purpose is to create a database that becomes a foundation. Now, the reason why we need to learn about documentation is because it needs to be what we call understandable to the rest of the healthcare team. Okay? It needs to be understandable to the healthcare team, no? Because as I've said, there is usually a turnover or a shift, no? A turnover of the shift, diba? So if I am the nurse today, tomorrow I might not be the nurse, no? So that's why our documentation needs to be uniform. It needs to be concise, it needs to be complete. Okay? And because of our completeness, our conciseness, no, it becomes a database. Okay? A database that anyone in the healthcare team can understand, not only you. Okay? So there are a few guidelines, no, when it comes to our documentation. Another purpose of documentation is nurses uses comprehensive and systematic nursing databases that streamline data collection and organization, yet maintain a legal or a concise record that satisfies legal standards. I've already said this before. The chart or our documentations, no, they are a legal document. They are a legal document. That's why I've said before, and I will continue to reiterate, no, you are not allowed to make any mistakes in the chart, because that may be viewed in court as tampering. Di ba? You're not allowed to make any mistakes, no? So, the reason why it is satisfies illegal standard is that it shows um wait it shows, no, the progression and actions of healthcare done by the team. Okay, it shows the progression and actions of healthcare done by the team. In a sense, class, documentation serves as evidence. Evidence. It serves as evidence that we have actually done actions for our patient. Okay? It serves as evidence, no? Ebidensya na nato siya. Okay. So, documentation standards. Every institution is unique when it comes to documenting assessments. However, two key elements need to be included in every documentation. The number one is our nursing history, katong atong subjective data, usually we get it from our client interview, and then our physical assessment, which is our objective data measurements. Usually we get it with our physical examination techniques. Okay? Now, every institution is unique, and as such, no, here in school we also have our own documentation standard, which I will show you later. This standard is what you will use when you go on duty from second year up until you graduate, no? The reason I'm gonna show you this standard is so that you can be familiar, no, as early as now, what to expect when you go on duty. Okay? But before that, let us discuss a few guidelines. The first guideline in documentation is you should make notes as you perform the assessment and document as concisely as possible. When we say make notes as you perform class, do not wait until the entire assessment is done to make notes. Okay? Let's say, for example, class, I am getting a person's blood pressure. Okay? After I get a person's blood pressure, I will immediately write it down in my what we call this documentation form. Okay? I will immediately write it down in my documentation form. If I find any abnormal finding, I will immediately write it down as soon as I find it. I will not wait for later. The tendency there is you might forget, di ba? You might forget its characteristics in general, no? So this will allow you to not forget. Para dili ka makalimot nga naa kay na-assess. Okay? Another is avoid documenting general, non-descriptive, or non-measurable terms. Avoid documenting general or non-descriptive, non-measurable terms. For example, class, do not, okay, tanaw ha, do not document, for example, poor wound. Okay? Poor wound. Okay? Instead, you have to be detailed. You have to use specific, descriptive, and measurable terms. Okay? So instead of saying poor wound, you should document something like this. The wound is 2 inches in diameter, red excoriated edges with yellow purulent drainage. Okay, do not document poor wound because that is just a general, no? It could signify a lot of things. It could signify a lot of other wounds, no? So you have to be very specific, very descriptive, and you have to use measurable terms. Okay. Another is avoid documenting general non-descriptive general same slide nung din eh. Okay. Okay, another guideline is to document legibly or print neatly in non-erasable ink. Now, when we say non-erasable ink, this is the reason why I do not allow you to erase during your exam, so that you will practice, no? So that you will practice not being able to erase or to properly document, no? So it's a practice to your documentation. Okay? Wait. So yan. Okay. So to practice your documentation, no? Yes, for example, class. So normally class, if there is an error or if there is an error in documentation, you do not do something like this. Let's say, for example, you wrote down the name wrong, okay? The name is, let's say, for example, the name is wrong. You do not mark it like that, okay? That is very wrong, okay? Instead, what you do, the correct thing to do is, for example, this is wrong, that is wrong. What I will do is I will strike it with a single line. Write the word error on top of what I documented, and then I sign it. Okay? I sign it with my initials. Okay? So that people will know that I was the one that made a mistake. I am held liable for that mistake. Another guideline, class, about this class is to never use corrective ink or correction tape. Never use correction tape. Okay? Keep in mind, class, that the health record is a legal document, and this might be seen as tampering. Health record is a legal document. Okay? Use correct grammar and spelling. The general guideline here, class, is use only abbreviations approved by the institution. Use only abbreviations approved by the institution. Okay? Avoid slang, avoid the use of slang, avoid the use of jargon or labels unless they are direct quotes from the patient. Okay? An example of using abbreviations approved by the institution is something like this. Okay? In the hospital class, we might say something like ID. Okay? We might chart something like ID. Now, let's say, for example, class, the hospital defines ID as intradermal. Okay? That is the hospital's definition of ID. That is how they use ID. So in that case, class, you should not, and I repeat, you should not use the abbreviation ID to signify identification. Okay? If na charting dito, class, if there is a chart there, class, that says ID, it probably signifies intradermal, not identification. That is what we mean. Ang problem ang good there is some abbreviations are very close with each other. Some abbreviations are very close with each other. An example of that is the abbreviation asa to? HS. Okay? HS. This is very common, class. Sa hospital, grabe. I see this almost almost every day, no? Especially in medication, this is a common medication error. You have to ask class how your hospital uses HS, okay? For some hospitals it could mean half strength, while for others class it could mean hours of sleep. Okay, let's say for example class, your hospital uses it for half strength. Okay, and then an order comes in, let's say for example insulin 4 units HS. Pak, insulin 4 units HS. But class, let's say for example class, tanga ka na nurse and you did not understand. Instead, you understood HS has half sleep. So the tendency there is hours of sleep. So the tendency there is you gave it during hours of sleep, even though it was supposed to be half strength. So ang ending class is you overdosed your patient. Diba? That's just because of a minor misunderstanding. Diba? That's why you have to confirm, or you have to check. Normally, when you are introduced or when you apply to a new hospital, they will give you a booklet that tells you their abbreviations, their common abbreviations that they use. No? Another class is avoid wordiness that creates redundancy. Oh my God. Avoid wordiness that creates redundancy. An example of this class is something like this. Okay? Auscultated vowel sounds in right upper, right lower, left upper, and left lower abdominal quadrants. Okay? Heard 32 sounds per minute. Now, that is too long, class, and you are being very, very, very redundant. Nagbalik-balik na kasi magpasulti. Instead, what you could say is vowel sounds present in all quadrants. Okay? At 32 sounds per minute. Okay? That way class, you are not being redundant. You are getting directly to your point. Okay? Avoid wordiness class that creates redundancy kini. What you're doing here class is you're just making your documentation look very long. Okay? It looks very long. And indeed, if imo gani patas on class, if you're gonna make your documentation very long, it might look impressive. But in the hospital class, what we are trying to achieve is easy understandability for all healthcare workers. No, so we have to avoid redundancy as much as possible, and a reason for to do that is to simplify what we write. Okay. Next is the use of phrases. In the use of phrases instead of sentences to record data. Now, phrases class, no, they are not complete sentences. They are not complete sentences. Whereas sentences class, they are complete. No, they have an absolute sentence structure. Sir, what do you mean by that, sir? Instead of recording something like the clients, hinay naman. Wala. Instead of recording something like the client's long sounds were clear both in the right and left lung. Okay, that is a complete sentence and it's too long. Okay, instead we can simplify it and use phrases. We could say something like bilateral, which means both sides, lung, which means the lung, bilateral lung sounds clear. Okay, as I've said, no, simplify. It is short, it is very, very concise. Okay, very short. It avoids redundancy. It avoids what we call this, making possible errors in charting. Okay, next is record data findings, not how they were obtained. Record data findings, not how they were obtained. Okay. Okay, what we mean by that is something like this. Instead of saying blood pressure was taken, do not say that because that is inconclusive. What you are saying there is you just did the assessment. Okay, you just did the blood pressure monitoring. What we want is the result of your blood pressure monitoring. So instead of writing that, you should say that BP while sitting is, let's say for example, 120/80. Okay? Do not record how they were obtained. Okay? Do not record how they were obtained. Instead, record your findings. Okay? Next is write entries objectively without making premature judgments. Same gapon class, no? Do not assume prematurely. Okay? Do not judge prematurely. An example of this class is something like this. Okay? An example of that is something like this. Okay? Client is depressed, locked in their room after cancer diagnosis. Yung kanako, sir, how is this a premature judgment? Now, class, can you really say, class, that they are depressed? Makaingon yun class. Can you really say that they are depressed? Have you done the assessment for depression? No. Okay, that is just a premature judgment. Instead, what you should chart is an objective type of charting. Client, it's like this, huh? Client crying in room refuses to talk and locked the doors. In that way, class, no? In this instance, class, we are not assuming. Okay? We are just stating the facts. We are just documenting what we are actually observing, no? Which is objective, di ba? Whereas when we say the client is depressed, man, we are assuming, no, that they are depressed because we have not done any sort of diagnosis. We have not done any sort of diagnosis to determine if they are really depressed. Okay? So in this instance, class, we are just stating the facts. So we know that the client is crying in their room, that they refuse to talk, and they have locked the doors. That is an objective type of measurement. Okay? Next is record the client's understanding and perception of problems. Okay? Record the client's understanding and perception of the problems. Now, this is very class. Now, this is oftentimes something that we we look past, no? Murag ato lang makalimtan. Sometimes we forget this, no? Because of all our duties, but it is also crucial that we record, no, how they understand or how they perceive their problems. An example of this type of recording is if the patient says, for example, as I've said, diba, it has to be a objective type of documentation. So when the patient says, client expresses concern regarding being discharged, okay, soon after surgery, okay, because of inability to rest at home with 6 children. Oh my God. Okay? The client expressed concerns regarding being discharged soon after surgery because of the inability to rest at home with 6 children. Okay? In this instance, class, no, I am recording how they perceive their situation. Now, this is important because it not only tells us something about their situation outside of the hospital, but it gives us the opportunity to help them or to find solutions for this problem. Okay? That is part of what we call our discharge planning. This is often overlooked, no? Okay. Next is avoid recording the word normal for the love of God, guys. This is very common. This is very common in the hospital, sa mga students especially. Okay? Do not record their class. For example, class, do not record liver palpation normal. Okay? That is wrong. Okay? Instead, you should be, as I've said, you have to be descriptive. You have to be descriptive. You have to be specific. You have to be specific, descriptive, and use measurable terms. Okay? Do not say liver palpation normal. Instead, you should document something like liver span 10 centimeters in right MCL and 4 centimeters in MSL. Okay? They have to be very specific, di ba? No tenderness on palpation. Yan na. No tenderness on palpation. Okay? Now, class, some healthcare facilities, class, no, ang ilang charting is they do something like charting by exception. Okay? Charting by exception. In that case, class, you will only chart if the result you found is abnormal. So if that is the policy of your hospital, class, and that is the policy of your hospital, then what you will do is just you will imo lang pasagdan, you will leave it blank. Okay, you will leave the, let's say for example kining liver, you will leave it blank if it is normal. But if there is an abnormal finding, that is the time you will chart by exception and then chart or document the abnormal finding. Okay, so yan. And lastly, class, is record complete information and details for all clients' symptoms. Okay? For all clients' symptoms. An example of this, class, is very common, class, ang atong pain. Okay? Do not say that client, do not say, ayaw pag-ingon na, client, do not chart or do not document that client has lower, client has lower back pain. Instead, class, you have to be specific, diba? And use the what we call our cold spa, diba? So we can say something like client reports aching back pain, okay, for 2 weeks. Pain worsens after standing for several hours. Rest and medications given to relieve pain. No radiation of pain. Pain scale is 7 out of 10. Okay? Inga na ako na mo pag-chart, class. This is just too inconclusive. What I'm learning by that, class, is there is just lower back pain. Okay? If ikaw nag-chart ani, class, if you are the one charting this and I am the nurse coming after your shift, I will just read this as the client has lower back pain. Whereas, class, when I see this, class, a more complete complete with information type of documentation, I will get the full context of the patient's pain. Diba? I will know that the pain has been persisting for 2 weeks. I know that the pain worsens after standing for several hours. It will let me know that the pain score is 7 out of 10. And all those sorts of stuff. It gives me full context. Now, in speaking of context, we will now apply it to what we call our documentation. As I've said before, I will be showing you the manual or the documentation form used by the University of the Visayas so that you will be familiar. Okay, it looks like this. It looks like this. Now, this is the medical surgical manual usually used during your 3rd year, no? But this is still usable and relevant in our discussion. Look, the first part, class, kining mga first parts, class, this is for the clinical instructors. Usually nga rin may mag-check sa inyong mga scores. Okay? Kana, inyo na mga scores. When we reach this class, we will get into our history. Diba? As we've said before, demographic data or biographic data comes first. No? So this is where we will write our demographic data. So let's say, for example, name of the patient, Justin, JL, diba? As we've said, it has to be initials, no? And then we have to finish everything, diba? Finish everything. And then history of present illness. This is where we will use our cold spa. Okay. Social history, family history, medical surgical history. In these instances, class, we will just check, no? Does the patient smoke? Yes. How many times? 1 pack a week. Okay, 1 pack a week. Yan na ba? Okay, does the patient drink alcohol beverages? Yes. Dili wine, beer, 1 liter per day. Ana, something like that. That is how we do charting. Yes. Substance abuse, yes. Frequency, 2 per week. Ano ba? Okay. That is how we use charting. Family history. Please create a genogram. Na genogram sheet, class. There is a genogram sheet where you will actually create a family genogram. Okay. So na past medical surgical history. You use same gapon. Check ka na nimo if it is applicable to your patient. Food and history allergies. Current medications class. Current medications, as I've said, diba, atong priority is to document. So this is where you will put their medications, the dose of that medication, how many times we give it in a day. Okay? Health patterns class. Narrative gapon na siya class. This is a narrative. Narrative na siya class. Kato na siya atong activities of daily living. Katong atong mga questions that we ask them in 24 hours. So on and so forth. Family genogram. And now we will we have achieved we have reached our head-to-toe assessment. So in head-to-toe assessment class, this is our physical examination. Let's say for example class, our finding is at narita sa sa eyes. Let's say for example during the assessment of the eyes, assessment of the eyes, you found out that the patient told you, I cannot see clearly. Okay, that is a subjective cue that should be added to your eyes. Now, imong findings class, let's say for example during the Snellen's test, okay, we found out that their right eye is 100/20 vision. 100, their right eye vision is 100/20. That is an abnormal finding, diba? It's supposed to be 20/20. And those are the types of, this is how we usually document, no? Let's say for example nga dito sa nose or sa throat. Okay, let's say for example, my teeth hurts. Okay, my teeth hurts. So makabutang ka dito. Okay, cavities found on left upper molars. Okay, yan na siya class. That is how we document our assessment findings after what we call this, after assessing our patient. No, not after class, as I've said, diba? You have to document as soon as you get the findings, no, or you see the findings, diba? So that is how we do it. It includes every system from head to toe, and there is also a systems review, a nursing systems review. This is where we check if there are bulging neck veins, if it's present, if the carotid is rhythmic in palpation, if there is symmetry between both carotids, no, our capillary refill time kanang sa atong kuan. This is how we check, type this, no, and we also need to make a narrative discussion of the cardiovascular system findings. So let's say for example, the patient has been observed with no bulging neck veins, etc. Very long. Okay, so muna siya, no, atong systems review. Okay, this will become more relevant to you class. This will become more relevant to you as soon as we discuss, no, or once we discuss the systems na gyud. This will be relevant to you once we discuss the actual systems. Okay, but for the meantime class, this will not, dili pa kaya it will not mean a lot to you, no. So yes, and lastly class, for our assessment class is our coping patterns, diba? The last questions katong mga self concept and self care. Okay, self concept and self care, no. So that is it. And as I've said, no, look at this, no, if you look a little bit down, nanatay discussion of anatomy and physiology. So that's what I have been telling you, no. Pag third year ninyo class, it will come back. Your best friend will come back for you. Okay? Now, that's it, no, but I have to give you an activity since you are section A7 and we will not be having classes, no, on Friday. So what's gonna happen is something like this, diba? You already have partners, diba, na mga partner sa katong inyong interview. Okay, here's what you are gonna do. Okay, if you were the patient, if ikaw ang patient sa interview, if you were the patient during the interview, you will be the one who will fill this out. Okay? Imo ni siya suwatan. Let's say for example the patient was JL. The patient was JL. You will be the one to fill this out. Okay? So you will print this from page 7 up until page 9 lang, because it was just an interview, di ba? Wala man to'y physical assessment. So if you were the patient, you will be the one to fill this up. Okay? Kaya para dili po alkansi ang katong nag-interview nimo. You will pass this on our next meeting. Okay? So yan. And